4 in 5 people among some 3,000 who went for tuberculosis screening in Bedok have tested negative for the disease. The remaining people who tested positive, some 470 of them, will need to undergo a follow-up chest X-ray to determine if their infection is latent or active. The Communicable Diseases Agency expects that most of them will not be infectious and therefore do not pose a public health risk. Charlotte Lim with this report.
A quiet afternoon at this hawker centre in Bedok, but only because it's a well-deserved midday rest for stall owners after a busy morning. This as customers are streaming back after a screening exercise for tuberculosis in the area.
现在好一点了，10到8线了。
我也是刚刚回来卖而已，所以我就今天的生意是不错啦，也很好啦，已经有上了78线了。
Customers say they felt more reassured as the days go by.
Was a bit scared lah. Was a bit worried when the news first came out because I think the news came out was quite brief. But it's like slowly after that, the minister mentioned that it's not an issue.
Not so scared because as she said, the minister came out and said that only with prolonged exposure, then you may be at risk. But we are not really here for long, so just having lunch.
The Communicable Diseases Agency revealed the results of the week-long screening exercise on Wednesday, which tested more than 3,000 people in that area for TB. The tests were done as a precaution after authorities detected 13 genetically similar cases across 3 clusters in Bedok Central between 2023 and February this year.
It's really part and parcel of standard procedure, really part of our TB regime in Singapore, early detection, surveillance and precautionary measures, and also making sure that we screen people who might have active TB. But so far, we have 0 cases of active TB here at Habib and as well at the hawker centre. 0 cases. But we are going through the next phase of screening and we will keep everyone updated.
The next phase includes having the people who tested positive, around 470 of them, to take a chest X-ray to assess if they have active or latent TB infection. On-site mobile chest X-ray will be conducted for free at Heartbeat at Bedok till 15th May for those who tested positive. Those diagnosed with active TB will be taken to the National Tuberculosis Care Centre for free treatment immediately. CDA expects most of the positive cases to have latent TB infection, which means they are not infectious and pose no risk to the public. But an infectious disease expert says it's possible that people with latent TB might develop active TB within their lifetime.
Usually this happens in slightly elderly, when over time, older people, and happens in people with impaired immune system, especially if a person were to contract a disease like HIV. If the person were to receive any medication that depress a specific kind of their immune system, there are some medication that has a higher risk of causing that. And if people like that are given such medication, their doctors will also screen for latent TB.
Dr. Low adds that early screening is important, especially if one develops prolonged fever, cough, and weight loss.